If you ever wondered about our decompression, this is the video for you. I'm Dr. Meagan von Holtz, and today I'm joined with some helpers. This is Dr. Clark. He's kind of a familiar and a new face. He was with us actually 12 years ago. Now he's back.
Yes, I came back to Jackson. I missed the friendly staff that you have here, and Dr. Shannon Bowell.
There you go. And this is George. He was actually a patient previously on the machine, so he's got a good perspective.
I'm George, and I started out here about 10 years ago. I started out as a patient. I was in here in the rehab area one day, and I said, I'm in here so much, y'all ought to put me to work. And the next thing I knew, they had me filling out paperwork and put me in pajamas, and I've been here ever since.
Very good. So today, the three musketeers are going to show you quickly how the machine works. So George is going to hook up Dr. Clark, and I'll tell you a little bit about the machine. So we use it for decompressing primarily herniated and bulging discs, and then also sometimes we use it for decompressing degenerative discs. Sometimes it works for facet syndrome too, which we see lots of times in younger people. So what George is doing here, he's just doing it quickly today so we don't spend your whole afternoon doing this. But there's a lower harness that gets put on and then an upper harness. And the idea is when the machine turns on, that's how we get a decompressive force on the discs. If you think about your discs, almost like an ice cream sandwich, you know, if you bite into it, how the ice cream can squirt out the back. So the same idea, if you have a weak spot in the back of the disc, when you bend and twist, that's commonly when people will start to have issues. That pressure can cause irritation or swelling all around the nerve. This machine actually, it's called the DRX9000. We have had it here in the office for about 12 years, so it's not brand new treatment, but really it's tried and true. We've had hundreds of patients on this machine and had really, really good success with it. The published studies show that it has about an 86% success rate in treating people with these disc issues. So what you'll see now, George is lowering Dr. Clark on the machine, and here if you look at the readout, I don't know if you can see that, but in a second we can start looking at these graph lines. One of the neatest things that differentiates this machine from some traction type machines is there's all these mechanical relays that go back and forth and sense the pressure of your muscles. So if your muscles start to pull back against the machine senses that, it relaxes the pressure and then starts to pull again, which really gives a more effective decompression force. So right now he's putting this under his legs just to relax the pressure, and then he's going to hook up.
Let your legs loose.
He's going to hook this up here where we actually get the decompression. And I can set this machine specifically for a certain lumbar area. We treat a lot of people at this L5, which is the very lowest area in the low back. But also, we've noticed, especially as we get older into our 50s and 60s, lots of times the disc issues come higher up. We treat a lot of people at L2. He's almost set here. And then I'm just going to show you what the pull actually looks like. Are we set to go?
We're set.
Alright, so the machine, it's going to start to ramp up. The pull is based on your weight. So typically if a new patient is starting, we would actually weigh you and we take a percentage of that to calculate what is the right pressure for you. And there are some conditions that do really well with this. Other conditions we actually use other machines. Like for instance, if you've had hardware in your back that has fused two segments together, then this is really not the best option for you. We have another option that would be better. But we have a lot of people come in here when they're trying to avoid surgery. That's what we primarily use this for. So you can, I don't know how well you can see, but the machine is starting to ramp itself up. You can see the pull right here. And I think what we'll do, George, is go ahead and unlock the bed now,
Okay.
so that they can see, if you look at the center of the table, it was closed and now it's opening. So that's the amount of decompressive force that Dr. Clark is getting in his low back when he does the machine. So I know, again, we just really did little bits of highlights because I didn't want to take up your whole afternoon. But if you have any questions about the machine, check out our website or give us a call. Again, this is Dr. Meagan von Holtz, Dr. Clark, and George coming from Advanced Rehab and Medical. Have a great day. Bye.